Hello, my name is Matthew McCarthy, and I will be presenting how the nursing shortage can be addressed by utilizing telehealth. In 2020, I started my RN career using telehealth as a home health nurse during the COVID-19 pandemic. We would use tablets to communicate with the patient's providers without having to leave their homes. This proved to be a useful tool in delivering quality and safe patient care. The pandemic caused a major shift in how the healthcare system was ran. At the onset of the COVID-19, many healthcare facilities closed and were transitioned to remote work. Registered nurses had to quickly learn how to provide care for patients with little to no training in telehealth. RNs also had to connect their patients with doctors and family members with the use of tablets. Remote patient monitoring increased, including pediatrics for the first time. The pandemic caused a severe escalation in the shortage of nurses, which was already at a critical level. 31% of RNs in 2022 indicated that they would likely leave direct patient care compared to 22% in 2021. 35% of inpatient RNs reported they wanted to leave in the fall of 2022, which increased to over 40% by the spring of 2023. RN staff turnover increased from 18% in 2020 to 27% in 2021. Rural hospitals lost more nurses to urban locations due to an aging workforce, older patients, lower salaries, and a more intense workload. Based on the results of a countrywide survey of 1,500 nurses from September to November in 2021, only 12% of nurses reported they were happy about where they worked. 80% of the nurses reported they were burnt out, felt underpaid, were frustrated with administrators, and their mental health was severely affected. Other factors have also affected the nursing shortage. By 2029, 71 million Americans will be 65 or older and will have longer lifespans and multiple chronic health conditions. 1/3 of U.S. nurses are baby boomers, and 640,000 are nearing retirement age. Although 170,000 nurses enter the workforce each year, the American Association of Colleges of Nursing reported that nursing schools rejected qualified applicants due to the lack of teaching staff. Telehealth is a possible solution to address the nursing shortage crisis. So what is telehealth? Telehealth is a subset of e-health and is the use of telecommunications technology in healthcare delivery, information, and education. Telehealth was originally developed to provide basic care to rural and underserved patients. In telehealth, interactions between patients and providers occur through the telephone or email, video chats, the internet, and remote devices. By April of 2020, in-person medical visits fell by 52%, while telehealth visits increased by 4,000%. What is telehealth in nursing? Telehealth nurses can promote and assess patient wellness, provide care in remote locations, manage chronic conditions, provide transition of care, and support end-of-life care. Telehealth nurses work in a variety of settings, including large healthcare institutes, federally qualified health centers, patient homes, and long-term facilities. Nurses use a variety of telehealth tools to interact with patients. In virtual visits, an interactive discussion takes place between the patient and nurse through video, telephone, or live chat. In chat-based interactions, the transmission of a patient's personal health data, vital signs, and other physiological data is retrieved online or through a mobile app. In remote patient monitoring, nurses are able to assess and monitor vital signs of chronic conditions like asthma and diabetes, and biometric data for blood pressure and glucose level readings. In the telepresenter mode, the nurse is in the same room as the patient and communicates with the provider who is in another location. Telehealth benefits include the following. It has increased the level of access to resources, care, and providers for patients in rural areas or where there are shortages in staff. Patients who have smartphones, tablets, laptops, or computers can easily connect with a provider who can diagnose, monitor, and treat a variety of acute and chronic conditions. There has been an improvement in the efficiency of care without the higher cost. Due to consumer demand, patients have been able to reduce their travel and wait times. Patients have experienced an improvement in the quality of care and are able to access providers who are not available in their area. So what are some of the barriers of telehealth? They would include some of the following. Critics argue that the quality of care is negatively affected by not having an in-person physical exam, which could result in a misdiagnosis or treatment plan. However, some states like Arkansas and Missouri do require an in-person visit before a physician can prescribe medications, especially controlled substances. Legal and liability issues have many rules, regulations, and guidelines that vary greatly by state and are constantly changing. The lack of multi-state licensure prevents providers and nurses from providing care to patients in more than one state. The security or privacy breaches of patient information have been a concern due to the number of staff who have access to the online healthcare system. Those in rural or underserved areas may have reduced internet bandwidth speeds, preventing them from accessing telehealth services. There is limited reimbursement from Medicare, Medicaid, and commercial insurance plans. However, as of 2021, 35 states have mandated coverage for telehealth services. People's perception of remote visits increased in acceptance and appreciation for telehealth during the pandemic. In a study conducted by Polinsky and authors in 2016, 3,303 participants were asked to rate their satisfaction with telehealth visits based on seeing images, hearing, and seeing the practitioner, assessing the capability of the nurse on site, the quality of care, convenience, and overall understanding. 94% of women and 99% of men reported they were very satisfied. 1/3 of participants stated they preferred a telehealth visit rather than a traditional in-person visit. The lack of medical insurance increased the odds of participants preferring a telehealth visit. Convenience and quality of care were reported as being important. So what is the future of telehealth and education? The lack of education for nurses in planning, implementing, and delivering quality patient care via telehealth services became evident during the pandemic. The University of Arizona's College of Nursing was the first to implement a telehealth certificate program for students in 2017. The American Telemedicine Association reports that telehealth could account for up to 50% of healthcare services within the next 5 years. To retain nurses in rural areas, the Health and Human Services Department is being urged to promote payment equity and incentives. The American Nurses Association has asked that the HHS to provide the following: a tuition loan forgiveness program for nursing students, especially those willing to work in rural areas. Federal financial assistance would provide nursing schools the ability to hire more instructors so more students could attend. So in summary, some of the highlights include the following. Research found that patients were highly satisfied with telehealth visits compared to the traditional in-person visits. Nurses can dedicate their time to educating and supporting more patients with the use of telehealth, which enables them to build more trusting relationships. Incentives such as tuition forgiveness and federal assistance for colleges could improve the number of students who can attend school to hopefully stabilize the workforce. Although patients and providers have experienced the benefits of telehealth, implementation has been slowed by regulatory, legal, and reimbursement challenges.